After 65, the brain is no longer the same resilient organ it was in youth, yet it remains astonishingly capable if given the right environment. One of the subtler changes of aging is the gradual weakening of the blood-brain barrier, the body's protective shield that carefully regulates which molecules and substances can enter the neural environment. This barrier is designed to allow nutrients in, filter out toxins, and maintain a stable chemical landscape for neurons to function optimally. Over decades, however, its selective permeability can diminish, leaving the brain more vulnerable to external influences. Medications that were once safely processed may now pass more readily into neural tissue, subtly altering communication between neurons and impacting the delicate balance of neurotransmitters that govern memory, focus, and emotional regulation. The aging brain also experiences changes in metabolic activity, blood flow, and neurotransmitter production. Dopamine, acetylcholine, and serotonin levels fluctuate more readily with age, and these chemical shifts are further influenced by compounds introduced through medications. When the brain's protective mechanisms are slightly compromised, even medications intended for minor ailments can produce effects that were not present in earlier years. Cognitive functions that once appeared resilient, attention, short-term memory, problem-solving, can begin to show subtle disturbances, often mistaken for normal aging rather than as a signal of external chemical interference. Another factor is the brain's reduced capacity to adapt quickly to new stressors. In younger adults, minor fluctuations in neural signaling or chemical exposure are often corrected naturally, with neurons and supporting glial cells adjusting their function in response. After 65, however, these adaptive responses slow, meaning that even small disturbances can accumulate over time. A medication that slightly slows neurotransmitter activity or alters receptor sensitivity may, over weeks or months, subtly shift the brain's equilibrium. These changes are rarely dramatic at first, but their cumulative effect can gradually erode cognitive clarity, making attention, memory, and emotional regulation less reliable than they once were. The vulnerability of the aging brain is not uniform across all regions. Areas responsible for memory consolidation, such as the hippocampus, and regions that support executive function, like the prefrontal cortex, are particularly sensitive to chemical disruptions. If medications interfere with signaling in these regions, the impact is often more noticeable, affecting the ability to form new memories, plan tasks, or maintain focus. Compounding this is the fact that many older adults take multiple medications, sometimes for blood pressure, diabetes, pain, or sleep, increasing the chance that interactions between drugs could amplify cognitive effects. The brain, already navigating a landscape of subtle age-related changes, must now contend with additional chemical stressors that it is less equipped to manage. Understanding the brain's changing defenses highlights the importance of careful medication review and monitoring. The protective systems that once allowed a wide variety of drugs to be tolerated now require deliberate attention to dosing, timing, and necessity. Even medications considered mild or routine must be recognized as capable of influencing neural communication in older adults, and awareness of this vulnerability is the first step toward preserving cognitive function. By respecting the brain's changing capacity, seniors can make choices that minimize disruption while still benefiting from necessary treatments. As the body ages, the brain's delicate network of chemical messengers, neurotransmitters, becomes increasingly critical to maintaining clarity, memory, and emotional balance. Neurotransmitters like acetylcholine, dopamine, and serotonin play essential roles in cognition, motivation, and mood, and their natural levels gradually shift with age. After 65, this shift is often more pronounced, making the brain more sensitive to substances that interfere with these signaling pathways. Medications that were once benign can now subtly alter the production, release, or reception of these chemicals, producing effects that may appear as forgetfulness, reduced focus, or emotional instability. Certain classes of medications are particularly likely to impact neurotransmitters. Drugs designed to calm anxiety, induce sleep, or control bladder function often act by dampening neuronal activity or blocking receptor sites to achieve their therapeutic effect. While these mechanisms provide relief for immediate symptoms, they can also reduce the brain's capacity to transmit signals efficiently. When acetylcholine activity is diminished, for example, the hippocampus, which is central to forming new memories, receives less stimulation, potentially leading to slower recall or difficulty retaining information. Dopamine suppression can reduce motivation and alertness, while serotonin interference can influence mood and sleep quality, creating a cascade of subtle cognitive changes that compound over time. Older adults are often unaware of how long-term or combined medication use can amplify these effects. Each medication may produce only a small shift in neurotransmitter balance, but when multiple drugs are taken concurrently, the cumulative impact can be significant. The brain's natural compensatory mechanisms, which adjust receptor sensitivity or neurotransmitter production to maintain stability, are slower and less efficient in later years. This means that repeated chemical interference may lead to persistent cognitive changes rather than temporary fluctuations. Even medications taken as prescribed can, over months or years, subtly accelerate the decline in attention, memory, and problem-solving ability. The timing and dosage of medications also influence their effects on brain chemistry. Older adults metabolize drugs more slowly, allowing active compounds to linger in the system longer than intended. This prolonged exposure increases the likelihood that neurotransmitters will be disrupted for extended periods, even between doses. The consequences are not always obvious immediately, as the changes can manifest gradually, blending into normal age-related memory lapses and making it difficult to distinguish medication-related decline from natural aging processes. The brain's sensitivity after 65 highlights the importance of regular review and careful management of prescriptions. Awareness that medications can interfere with neurotransmitters allows seniors and caregivers to make informed decisions, balancing the relief of physical symptoms with the preservation of cognitive function. By monitoring effects closely and consulting healthcare professionals, individuals can minimize unnecessary interference with the brain's chemical networks while still addressing essential medical needs.
As we age, the way multiple medications interact in the body becomes increasingly important, particularly after 65, when physiological systems are more sensitive and less resilient. The cumulative burden of several common prescriptions can subtly strain the brain in ways that are not immediately obvious. Each medication has a primary purpose, whether to control blood pressure, relieve pain, ease anxiety, or manage sleep, but they also carry secondary effects that influence neurotransmission, blood flow, and cellular metabolism. When these effects overlap, even slightly, they can accumulate, creating a scenario in which the brain must process multiple chemical signals simultaneously, sometimes sending conflicting instructions to neurons and glial cells. The concept of cumulative cognitive burden is both simple and profound. Unlike a single medication causing a dramatic reaction, multiple medications often produce small additive effects that unfold gradually. One drug might slightly reduce acetylcholine activity, another could dampen dopamine signaling, and yet another may influence serotonin balance. Individually, these shifts may go unnoticed. Combined, they can subtly impair attention,
memory, mood, and executive function. Over weeks or months, the cumulative effect becomes more apparent, resembling what might be mistakenly attributed to normal aging rather than a modifiable pharmacological influence. Older adults are particularly vulnerable because the body's metabolic and excretory systems change with age. Liver enzymes metabolize drugs more slowly, and kidney function declines, meaning active compounds can linger longer than intended. This prolongs exposure to substances that affect neurotransmitters and increases the likelihood of interactions. Polypharmacy, taking 5 or more medications simultaneously, is common after 65, especially among those managing chronic conditions like hypertension, diabetes, arthritis, or sleep disturbances. Each added medication raises the probability that cognitive function will be subtly affected, even if none individually is considered high risk. The brain's adaptive capacity also diminishes with age. In youth, neural systems can often compensate for temporary interference in signaling, maintaining attention and memory despite minor chemical disruptions. After 65, these compensatory mechanisms slow, and the brain becomes less forgiving of repeated or overlapping disturbances. What may have been a minor inconvenience at 50 can manifest as noticeable forgetfulness, slowed thinking, or reduced problem-solving ability in later years. This makes the cumulative effects of multiple medications especially important to consider, because the changes are gradual, reversible only if addressed promptly, and often overlooked until they significantly impact daily life. Understanding the cumulative cognitive burden of medications encourages thoughtful review and management. It is not an argument against necessary prescriptions, but a call for awareness, careful monitoring, and collaboration with healthcare professionals. Adjusting dosage, timing, or choosing alternative therapies can reduce overlapping effects, helping the brain maintain clarity, memory, and emotional stability. By recognizing that multiple medications can interact to influence cognitive function, seniors can take proactive steps to preserve mental sharpness while still addressing their health needs effectively, ensuring that quality of life remains central to the approach to treatment. Certain types of medications commonly prescribed after 65 have a subtle yet profound effect on the brain's chemistry, particularly those intended for sleep, anxiety, bladder issues, or allergies. While these drugs provide relief for immediate physical or psychological discomfort, their mechanisms of action often involve altering neurotransmitter activity in ways that can interfere with memory formation, attention, and emotional regulation. For instance, sleep aids may depress neural activity to induce rest, but prolonged suppression of alertness pathways can reduce the efficiency of synaptic communication over time. Similarly, anti-anxiety medications often target receptors that regulate excitatory signals, and when used chronically, these same pathways can become less responsive, making it harder for the brain to adapt to new information or maintain cognitive clarity throughout the day. Bladder medications, particularly those with anticholinergic properties, illustrate how drugs designed for one purpose can inadvertently influence brain function. Acetylcholine is crucial for attention, memory encoding, and learning, and medications that reduce its activity can subtly impair these processes. Over months and years, these small changes accumulate, slowing neural transmission and reducing the efficiency of memory consolidation. Even mild cognitive disruptions caused by such medications can create noticeable differences in daily life, such as forgetting appointments, misplacing items, or struggling to follow multi-step tasks, which often appear as normal signs of aging, but may be medication-related. Allergy medications, especially older antihistamines, also interact with the central nervous system in ways that can impact cognition. By crossing the blood-brain barrier, they can induce drowsiness, slow mental processing, and blunt the brain's natural alertness cues. In an older adult, where neural resilience and compensatory mechanisms are already reduced, these effects are magnified, contributing to an environment in which neurons communicate less effectively. Over time, even occasional use of such medications can subtly impair problem-solving, attention, and short-term recall, particularly when combined with other prescription drugs affecting similar pathways. The compounding effect of these medications is amplified when they are used concurrently, as is often the case in older adults managing multiple health concerns. Each medication may independently cause minor cognitive shifts, but together their interactions can reduce the brain's overall efficiency. What might be a mild, temporary effect in a younger individual becomes more pronounced in someone over 65, as the aging brain's adaptive responses are slower and less flexible. This cumulative impact can mimic or accelerate age-related cognitive decline, often delaying recognition of the problem and complicating efforts to intervene. Awareness and monitoring are essential strategies for preserving cognitive function in the presence of these medications. Understanding which drugs have potential impacts on neurotransmitters and brain signaling allows seniors, caregivers, and healthcare providers to make informed decisions about timing, dosage, and alternative therapies. Simple adjustments, such as evaluating necessity, spacing doses, or exploring safer alternatives, can significantly reduce cognitive interference. By remaining mindful of how these medications interact with brain chemistry, older adults can maintain memory, focus, and emotional clarity while still addressing their physical or psychological symptoms these drugs were intended to treat.
The challenge of medication-related cognitive decline after 65 is compounded by the fact that its effects often resemble normal aging, making it difficult to recognize and address early. Memory lapses, occasional confusion, slower problem-solving, and diminished attention are frequently dismissed as an inevitable part of getting older, rather than potential consequences of the substances intended to improve quality of life. This subtle blending between natural aging and medication influence can delay intervention, allowing small cognitive disruptions to accumulate over months or years. By the time the connection is identified, the brain may already be struggling to maintain optimal function, and reversing the effects can take considerable effort and careful management. This overlap between aging and medication-related cognitive effects highlights the importance of vigilance. Seniors and caregivers need to observe patterns rather than isolated incidents, noting whether lapses in memory or attention correlate with medication changes, new prescriptions, or dosage adjustments. It is also essential to understand that the brain's adaptive mechanisms slow with age. Neuroplasticity, the brain's ability to reorganize, form new connections, and compensate for disruptions, is diminished after 65. As a result, even minor chemical interference from medications can have a more pronounced and lasting impact on memory, learning, and emotional regulation than it would have in younger adults. Polypharmacy further complicates this picture. Many older adults take multiple medications for chronic conditions, and each additional drug increases the likelihood of cognitive side effects. Sleep aids, anxiety drugs, bladder or allergy drugs can all contribute to subtle cognitive interference. When these drugs are combined, their interactions may not be immediately apparent, and the resulting cognitive changes can seem indistinguishable from normal age-related decline. This is why careful medication review with healthcare providers is crucial, not just for physical health, but for maintaining mental clarity and independence. Another factor is the delay in recognizing the impact of medications on cognition. Unlike a sudden stroke or acute illness, the effects of these drugs unfold gradually. Short-term memory may fade, attention may waver, and processing speed may slow, but these changes are often attributed to normal aging rather than pharmacological influence. This misattribution can prevent timely adjustments, prolonging exposure to substances that subtly disrupt brain function.
Awareness and education about the potential cognitive effects of commonly prescribed medications empower seniors to advocate for themselves and engage in discussions with healthcare professionals about alternatives or dosage modifications. Ultimately, recognizing that medication-related cognitive decline can mimic natural aging provides an opportunity to intervene thoughtfully. By maintaining open communication with doctors, monitoring mental clarity, and periodically reassessing the necessity of each prescription, older adults can reduce unnecessary cognitive burden. This awareness helps preserve memory, attention, and executive function while still benefiting from medications that address physical or psychological health needs. Approaching medication management with mindfulness and care allows seniors to navigate the later decades of life with greater clarity, independence, and confidence, ensuring that treatments intended to enhance quality of life do not inadvertently compromise cognitive well-being. The most unsettling truth about the aging brain is that harm does not always arrive as disease, but sometimes as silence. It happens quietly, pill by pill, prescription by prescription, often given with good intentions. After 65, the brain becomes exquisitely sensitive to chemical signals, and substances once tolerated can begin to interfere with memory, attention, and emotional clarity. The question is not whether medicine helps, but whether some medicines unintentionally ask the brain to trade short-term relief for long-term confusion. After 65, the brain's protective barriers weaken, allowing certain medications to interfere more easily with memory and neural signaling. Drugs that suppress alertness or block key neurotransmitters can accelerate cognitive decline when used long-term in older adults. The cumulative burden of multiple common medications matters more than any single prescription. Sleep aids, anxiety drugs, bladder or allergy drugs can all contribute to subtle cognitive interference. When these drugs are combined, their interactions may not be immediately apparent, and the resulting cognitive changes can seem indistinguishable from normal age-related decline. This is why careful medication review with healthcare providers is crucial, not just for physical health, but for maintaining mental clarity and independence. Another factor is the delay in recognizing the impact of medications on cognition. Unlike a sudden stroke or acute illness, the effects of these drugs unfold gradually. Short-term memory may fade, attention may waver, and processing speed may slow, but these changes are often attributed to normal aging rather than pharmacological influence. This misattribution can prevent timely adjustments, prolonging exposure to substances that subtly disrupt brain function. Awareness and education about the potential cognitive effects of commonly prescribed medications empower seniors to advocate for themselves and engage in discussions with healthcare professionals about alternatives or dosage modifications.